you know, could follow that, add anything.
And I have a friend, maybe you should contact her. I have a friend living in the area of Toronto, in Ontario, in London.
Okay.
She's British. She
Okay.
was a coordinator in Cambridge with Sir Roy Carl at the beginning of the liver transplants and so on. She's a very active woman. And she wrote me an email. She's making some kind of work for the health authorities in organizing tissue donation, organ donation in the area of Ontario.
She's from England?
Yeah, she's from
so
Cambridge.
She's visiting
yes.
then?
No, she's living
there.
actually there because her husband moved to Canada to work in the university maybe 5-6 years ago. So
oh, okay. If you can, I'll get her name.
I'll get the email.
Okay, perfect. Perfect.
And then I'll give you at least the email. Maybe it would be interesting to contact her because she's organizing some. I mean, she's not really working for the authorities, but I think that she's cooperating with the authorities somehow.
Yes.
I don't know exactly the way or the exact link or. But she's doing something.
Okay. Well,
and then she was very active here in Europe, working in organ transplantation and coordination of activities and so on.
Well, it sounds like you know, it is somebody that you know, we can help each other.
Yeah,
so,
of course. And then you live. Well,
and I live very close to London. Yeah,
not
so
too far.
Not too far.
Well, everything's kind of in Canada is
it's
too far.
Yeah. It's actually the biggest country in the world right now.
Well, you saw the weather is quite different from your country.
Yes, it is. We suffer, except for West Coast in Vancouver. They are very fortunate to have good weather there all year. But in all other parts, the rest of Canada.
Last week I was in Seattle.
Seattle, yes.
It was awfully warm. Warmer than here.
Yes, they have incredible weather. It's amazing. It's amazing because they are on the same
line, but they are protected by the mountains.
But they are protected, so you know, most people that visit the West Coast do not come back.
So you will be here for 3 days.
Yes, I'm leaving on Thursday. And tomorrow or Wednesday I have arranged to meet with Dr. Pina. But you know, any other thing that might be able to gather while I'm here, because I want to gather as much things as I possibly can.
We will see what can be organized.
Okay.
Okay.
So if you can just introduce.
My name is Blanca Miranda. I'm a former nephrologist. I was training in nephrology. And
sorry, can you start over again? I didn't. Sorry.
My name is Blanca Miranda. I was trained in nephrology and I was working in nephrology for, let's say, 13 years. But since, let's say 12 or 13 years, I'm devoted to transplant coordinator and working in the transplantation field specifically. And not only in kidney transplantation, but in any kind of organ and tissue and cell transplantation. And I was in charge of the National Transplantation Organization for 8 years, since 1996 until 2004. Your first question is how did the public media, churches, hospitals, etc. react at the beginning? Well, the law was passed in Spain in 1979. The first mother text of the transplant statements here in Spain was stated in 1979. And it was very well accepted. I mean, I must say that Patients Association, the Kidney Patients Association in Spain, worked very close together with the authorities in preparing the law, as well as the professionals. So the law was a very short one, a very simple one. Just stating very basic principles on what should be the criteria for accepting deceased donors, living donors, and the criteria for authorizing centers and for providing the centers to an organizational system to deal with organ procurement and transplantation. And then the story of brain death that was enacted in this law and then developed in a royal decree did not have any impact, I mean, in the mass media at that time. I mean, you must realize that at that time, the late 70s, many laws were passed in Spain at that time, because if you remember, maybe you don't remember, the story of Spain was changed drastically in 75. Franco, the former dictator, died, and then 76 the democracy was restored in Spain, and then hundreds of laws and statements needed to be developed at that time. So transplantation law was one more in hundreds of laws. So you must put the things in the context, and then maybe it was not so important for our life at that time. Things were so quick at that time, happened so, I mean, everything went so fast. I mean, you didn't have the time to realize that now we have this other, let's say, every national organizational systems, every democratic systems of working were put in place at that time. The parties, the elections, the constitution, so big events at so impressive speed of development that really the transplantation law passed. Well, it passed. And then transplant started to, at the same time, the general health law was passed, the organization of the life of the hospitals in a different way, public health system. So everything was mixed. There was no a simple law or a simple thing in which the government at that time was occupied, but in so many things that and the normal life and the social life was impacted by so many things that really there were no big impact on transplantation exactly, or the transplantation on mass media or on the society. So it was, well, like any other activity in our health system. It became normal to have transplants or to have donors in the hospitals, in some hospitals, etc. So from 1997 until 1987, yes, things were going ahead slowly, but well, at the time in which everything in public health system was reorganized, many things happened at that time. So, well, things in transplantation were in parallel with other developments at that time. Then in the late 80s, the patients' association that were involved in the preparation of the legal texts and very active in ways the care of the kidney patients were able to pass a claim to the ombudsman stating that the transplantation rates in Spain were not so good, were not good enough, were not comparable with other countries, other European countries, and they claimed because they thought that the government was not doing exactly everything possible in promoting organ donation and organ transplantation, and they wanted the government to do other things to promote organ donation and organ transplantation. So the ombudsman accepted the claim of the patients' association, and the government was then obliged to do something. That was in 1988, 89, and then at that time the government decided to create this organization, the National Organization of Transplants, to give enough budget, enough people working on this organization, and then several functions to be developed by this organism. Making the point and the effort on organ donation and procurement. The difference of other organizations in the world that were developed at the beginning to allocate organs following the HLA system, like Eurotransplants or France Transplants or the former UNOS, were organizations that were in principle were set up to allocate organs, to manage the waiting list, and to organize this kind of things, statistics and so on. We were in charge of allocation of organs, but mainly we were in charge of promoting organ donation. That was the main problem. So at this point, I have to state that this made the difference between the National Organization of Transplants in Spain and other organizations. I mean, we were born with other aims, or with other main aims. So we have to allocate organs, but we mainly have to promote organ procurement. From the very beginning, we realized that without any organs procured, we would not have any organ to allocate. And on the other hand, another difference at that time was to realize that donation should be taken into account like any other medical activity in the hospital. Organ donation is a medical activity. The donor was a former patient, now is a dead person, but it's a medical activity. It needs to be evaluated from the medical point of view, needs to be managed from the medical point of view. Procurement is a surgical activity, transplantation is a surgical activity. So everything related to donation and transplantation is a medical activity. So forget this social, not forget, but don't put the emphasis on the social side of the donation, which is very important, of course, at the beginning, but do not forget that the medical activity should be taken into account. We cannot proceed only with a very beautiful and very nice transplantation units with big budgets, with marvelous and prepared surgeons. If they do not have any organ, they will not go further. So donation is medical activity, takes place in the hospitals, needs specific budget, needs specific people, and needs specific training for these people. And this was another difference between the Spanish system at that time and other organizations at that time. So then, from the very beginning, the hospitals could get the budget for the donation. It is simple and easy. If you have only $2-3 per year to allocate the budget of these donors into the general budget of the hospital. But when you get $50-60 per year, then things are not so easy. And then the donor is something that costs. I mean, the evaluation, the management, the ICU bed, the surgical procedure. And then costs not only money, but costs human efforts. And if you use the people that is on duty in the hospital to procure organs, those people cannot proceed with the normal surgery of the hospital or the normal emergency room of the hospital. So you need people specifically on call for organ donation, specifically paid to be on call for the processes of organ donation. You need not to interfere with the normal life of the hospital. If you interfere economically or from the point of view of the human resources with the normal life of the hospitals and other patients, then this could be like a boomerang against you. And you will not be able to go further because you will have all the people in the hospital against you. So this was another very important point. Another point was to modify the law in the late 90s in order to facilitate cell and tissue procurement and the organization of the cell and tissue procurement and transplantation, and to transform the former law, the former first royal decree, and adapt this legal text to the evolution of what is the scientific knowledge in what's related with brain death, the new tests that were at that time at the disposal of the ICU people to diagnose brain death, etc., etc. So, organization, budget, legal framework, and to have the specific people in place in the hospital responsible for organ donation and trained to deal with the organ donation processes. So these are the main points in which we based our activity. Then this is done in the hospital, but we at the national level, we manage the waiting list, we allocate organs, we organize the procurement, the shifts, the travels, and etc. of the teams, and we proceed with the statistics and all the things that any organization does in order to come back with the results and then see what's going well, what's going wrong, what should be improved, what are the actions that should be put in place. At that point, I mean, we were able to control every death in the ICUs, in the hospitals that are authorized to deal with organ donation. We know exactly how many people die in these hospitals in encephalic death, how many of them are transformed into actual donors, why those which are not transformed into actual donors, why they are not transformed into such disposable donors or possible donors, and if those reasons are can be overcome or can be changed, then we promote actions in these hospitals or regions to change things that are not going so well. So year after year we are improving the rate of organ donation because we know exactly all the processes of encephalic death and the outcome of these encephalic deaths. But what was very important was to in the second modification of the legal text to introduce the concept of non-herpetic donation. You will see next Wednesday, when you will visit the hospital that you will visit, the biggest program of non-herpetic donation here in Spain, which is in relation with the extra-hospital emergency services. And they have a cardiac arrest, and this can be a donor. They transfer this body to the hospital, they proceed with the obtention of organs, and then you have to realize that in the United States, last year, for instance, they have grafted, in 2003, they have grafted 400 organs from non-herpetic donors, and here in Spain we are only 43 million people. They are 258 or so. So with 20% of the population of the United States, we have grafted here in the Madrid region more than 125 organs from non-herpetic donors. So, and this can be also put in place in other cities and in other contexts. So it is quite important to have the legal framework to be able to proceed with this kind of activities, because in some European countries this is simply forbidden, like in Germany. They cannot use non-herpetic donors. On the other hand, it is also very important that the legal framework is adapted exactly to what the society wants from you. For instance, in what's related with living donation, which is something that we have to improve here in Spain, because there are very few transplants done with living donation, and then we could improve that story. You also asked quite a lot of questions about the relationship with mass media, etc. I have been speaking about the technical side. I mean, what did we do from the technical point of view? Evaluation of the donor, promotion of donation, medical activity, legal statements, organizational activities, etc., statistics, and so on and so on. But there is also a very important and crucial role of the society in transplantation. In fact, transplantation is probably the only medical activity that needs the participation of the society. We cannot proceed only with more research, more investment, more human resources, more budget. I mean, you cannot proceed only, you need those kind of things, but you cannot proceed only with these kind of things. We need exactly the people cooperating with our system. If the people does not give you the organ, if the willingness of the people is not positive to the nation, you will not have anything. So don't forget the other side, I mean the two pillars, the technical side and the social, or the human part of the story. What did we do at that time? Well, we have a program to promote organ donation in Spain. This program is a big national program divided into 4 areas. One area is general population, the other area is some specific groups. The other area is the people working in healthcare, including pharmacies. And the other 4th area is the specific interview for donation to the families. So those are the big 4 areas in which we work. In the first one, society, we include all the activities that are related to the society. I mean, campaigns, information, surveys, polls, etc. Work. I mean, all the work that has been done with general population, and it's being done. We produce material for information, etc. In the second area, specific group, which are the specific groups with which we work? First is, of course, mass media. We have a very, very strong relationship with mass media. All the coordinators in Spain know the people writing in the local newspapers about science or society, and then have a very close correlation with those journalists. We follow all the written news about transplantation that appears on national and big newspapers in Spain. We have more or less 2,500, 2,800 news every year that we evaluate. Most of them, more than 90% of them, are positive, at least are not negative news, or are not problematic, or let's say maybe not negative, but could be how do you say it in English? Well, problematic can be the word, or negative even. Most of them are neutral or even positive, and then most of them are related with transplantation, or at that time cell therapy, or the impact or possible impact of cell therapy. But they never forget absolutely donation. We always have news about donation. We have this National Day of Organ Donation, National Day of Donors, National Day of the Kidney Patient. Then at that time, generally, we give statistics or information that appear on the newspapers, etc., and then we comment with the journalists. But the most important thing is that we have this close relation with the journalists. We have our telephone open 24 hours for them to call us and to ask anything. If they receive any type in their desk about organ transplantation traffic or any problematic issue, and then they want to check with us this information, they can. We are always available. And this is true also for the coordinators of the hospitals and the regions. So if they want, they can. Sometimes they do not want, they do not ask, or they do not call, and they produce the new without any relationship with us. But generally the relation is very good. Besides, we every year organize a meeting with journalists, and then we have journalists, 1 or 2 journalists from every of the 17 regions in Spain, journalists that are more or less specialized in medical issues or healthcare issues, or write about these things. And then the meeting is 2 days meeting, and the most important thing are not the lectures, but the most important thing is the contact with them. They know about our work, we know about their work, and in that way this knowledge gives us more trust in the other. So in general, journalists are people that is not very well accepted by the society. Oh, journalists. And then at the end, they are people doing their job. So it's very important for us to know that they are just people doing their job. And they have bosses, and they have sometimes pressures, and they have sometimes other things impacting in their normal life. So in that way, knowing each other, we promote the trust in between the groups. And I think that this is very important to proceed together. We make the same thing with judges and coroners, and this will be the eighth year that we have been having this kind of meetings with these groups, specific society groups that could have more impact on organ donation and transplantation. And I must say that this meeting, for instance, with judges and coroners, lead us. I mean, they allowed us to have the doors of the judges' school open for us. We now go every year. 1 complete day is dedicated to organ transplantation in the school of judges here in Spain, which is in Barcelona. Judges in Spain are lawyers that passes a very strong exam. They can be 3-4 years preparing this exam, and after passing the exam they have to go to the school for 1 or 1.5 years. At that time, during this 1 year or 1.5 years, besides this day that is devoted to organ transplantation, they can be on call for any if they want to see a complete process of organ donation and transplantation. Some of them, they are in a list, and then when we have donors, they are placed in Barcelona. When we have donors in Barcelona, we call them, and some of them goes to the hospital and see during all the time that is deserved to the donor. They see all the process, and then the most important thing is not exactly the theoretical part of the work, which is important, but this practical part of the work. I mean, they can see directly what is a process of organ. And then when they work in a judge and they have to sign the authorization as a judge or a coroner, the legal authorization to proceed with organ donation when the donor did have a violent death, they do think different. But besides that, they have families, they have friends, they have. And what is very important, again, is that we know each other. I mean, the judge is not some body which is making trials, or which is very far from us, but it's a person that can eat or sleep or speak with us about different things. And so these kind of meetings have been very, very important for us. Another thing, another group is the educators. We have the idea, because we have made some studies with teenagers, and teenagers in Spain do not know many things about donation and transplantation. And if the teenagers are students of humanities, less. I mean, if they are science students, they know something, they have an idea of what's transplantation, etc. But if they are humanistics or they follow humanistic studies, then the knowledge about donation and transplantation becomes very, very low. Then we have produced some materials to train the educators of these boys and girls in that subject. And other groups which we work specifically are those groups that could have some cultural different behaviors, for instance Muslims or other groups with which we work in promoting organ donation and transplantation. In the third area, of course we work in the second area with patients association. We train the patients associations to deal with those work of promotion that they do in, let's say, with the neighbors or with the kids in schools or whatever. So they can have access to the information or to the set of slides or whatever that could, or to videos that could help them in these interventions that they have locally. And so on and so on. There are many, many activities in the different areas. The third area is the area of the healthcare people, and mainly the healthcare people that do not have any direct relationship with donation and transplantation. I mean doctors and nurses that are working in different areas, that have families or patients that will ask them about donation and transplantation. And mainly general practitioners. General practitioners are the people that is more close to the normal life of the people. Those in Spain the name is the doctor of the family. And then the doctor of the family that supposedly is the first step to access to the healthcare. And we try to train them in what's donation and transplantation and etc. And also the people will ask quite a lot in the pharmacy. I don't know why, but when the people goes to the pharmacy, they ask about anything, headache or constipation or donation. And then we try also to get access to these professionals in order to have them. But at the end, we are really not very, very effective, because 2 years ago we made a study with an organization of customers, and then 51% of healthcare centers did not inform at any level about organ donation or transplantation. I mean, if you go to the healthcare centers, big or small, and you ask, please inform me about organ donation, do you have any information saved, or do you have somebody that 51% of them will say to you, no, I do not know anything, I do not have anything. So we really are not very effective in that point, and then this is something that needs urgent improvement. And finally, which is the very, very important point, the interview to get towards the relation with the families in the exact point at which they have lost the relative, they are in this emotional blockage that is the first thing that happens when the death happens suddenly. I mean, the donor is always somebody that die suddenly without any prolonged or large disease, or in hours, in 1-2 days, things change so dramatically that the families suffer quite a lot, and the emotional blockage is important. I mean, you cannot go through this blockage. It's very difficult to penetrate this blockade and then to transmit information, and then it's very difficult for them to assimilate this information. And it deserves to be very well trained, the coordinators, to be efficacious in the relationship with the family. So we have specific training programs that are dealt by professionals of the psychology and professionals of the coordination, and then we train all the coordinators, the hospital coordinators, in these programs. And we also have developed a system of evaluation of the interviews. So we have a systematic evaluation of the interviews. Then you can go, after having the interview with the family, you can go and check your checklist and see what's going wrong, or I forget that thing, or I should stress that other point next time, etc. This is very difficult because there are no two interviews that are the same. I mean, when you have been a transplant coordinator and then you have interviewed different families, you can remember each one. Each one is a drama, different drama. Each one is a different family. I mean, you never can be the same person with a very strict protocol to be followed. Like, let's say, first day treatment of the acute myocardial infarction, or the treatment of shock septic. The donation process is always different from the previous one, and then but it's useful to have this knowledge. I mean, if you want to go by car from here to let's say Frankfurt, probably you will arrive with the indications of the road. But if you have a map or a GPS, you will arrive more easily. Then you know how to drive, you know how to read the GPS, you know how to read the indications, you know how to read the map, and then you will arrive to Frankfurt. Obviously, you would arrive the same without any of this knowledge, probably, but it's easier if you get these tools. And that was very summarized, the program for the promotion of organ donation and to decrease the family refusals in Spain. Costs, economics. Well, I will say only that with the money that is saved in dialysis costs with the people that is living with a kidney transplantation every year, we can afford the cost of 2 complete systems of organ donation and transplantation in Spain. So if it's cost effective, yes, definitely. Only with the costs of current dialysis. You can afford 2 systems like us in Spain, like ours, including everything: donations, coordinators, planes, transplantation, etc. What else? think I covered. I don't know if you have something else to ask. Media.
Has there been ever any
Opposition?
opposition?
Yes, of course.
From
I see people at the beginning were not exactly promoting organization. Now they realize that this is something that is related with their normal life and job. It's like to treat a septic shock. You cannot avoid to treat a patient that arrives at the ICU now. Most of the intensive care people do realize that they have to take care of donors. And in fact, in following this this quality control system on the processes of organ donation, the rate of unreferred potential donors or encephalic deaths is very low. It's less than 1.5%.
Is that because the people are using things like seat belts and other things to prevent?
No, well, nowadays most of our donors are, well, maybe 70-75% of our donors, not 75, but yeah, 75. Between 70 and 75% of our donors are dying due to stroke or anoxia, or not exactly due to trauma. Only 15% of them die in the road. Many people die on the roads in Spain, but they die on the road, so they cannot be recovered.
Some people that were not agreeing that Spain was leading the world. Because of the system necessarily, they were saying, and these are people that I had countless arguments with, because Spain had such a high rate of traffic casualties.
In fact, there is a very high rate of traffic deaths, not exactly the highest in Europe, but it's maybe, it's maybe double than not exactly double, but 70% higher than in the UK, or in relation with the number of cars. But these are always statistics. I mean, for instance, the cars that we have in Spain are the cars that we have in Spain, but we do not know exactly how many cars we do have during the summer, because it is unbelievable the number of people from Morocco that crosses Spain from Belgium, France, Switzerland, and goes on holidays to the country. It's unbelievable, and you can find one, another. Yeah.
It's impossible to document.
Thousands, so it's very difficult. They have more or less an idea about how many people, because now frontiers are opened, and then you cannot control. The circulation is open now, so you cannot control how many people crosses the. And on the other hand, we do have more or less 4,000 deaths on the road every year, and we do have let's say not more than 200 donors which death was related with traffic accident. So it's 4,200. I do not have the figures for other countries. How many is the proportion in relationship with the traffic accidents?
Is there any measures or statistics taken to find a number of the true potential of availability?
Yeah, we have these figures on what is the ICU death rate, and the rate from the ICU death rate in the hospitals that are authorized to deal with organ donation, because not all hospitals are authorized legally to deal with organ donation processes. Only 154. I mean, you need, as a hospital, to be authorized to deal with organ donation. You need to fulfill some criteria, which is to be able to evaluate the donor, to be able to have surgery procedures, etc., etc. So only 156 are authorized, and in those hospitals, yes, among the nearly 1,000 hospitals that we have in Spain, but only 100.
To gather these type of statistics?
Yeah, we need ICU, and they need to have ICU facilities, the possibility to diagnose brain death with all the facilities to diagnose brain death, all the facilities to evaluate the donor. I mean, you need 24 hours a day, 7 days a week, yes, to be able to make any analysis, any set of information, etc.
So from the 156, it does give you a good idea.
Yes, and then from these hospitals, we know how many people die in the ICUs. 12% of them are encephalic death people. Now we are in 52% efficacy from these people dying in encephalic death. 52% nowadays are transformed into actual donors, and the most optimistic scenario, with less than 1% unreferred, less than 3% presenting with cardiac arrest, less than 20% presenting with some kind of medical contraindication to organ donation or procurement, and the other things like organizational problems or coronary refusals or lack of recipients or any other problems, altogether less than 5% losses. And if we keep the family refusal rate on this 15% of all interviews, which is 10% of the losses, but 15% of all interviews, the ideal scenario would be 65% efficacy. So all the encephalic deaths, 65% of them could be transformed into actual donors. And you have to realize that more or less in Spain, 2.5 organs are used per donor. So this means that we could increase from 33, 34 donors per million up to 38, 39 donors per million. And then we could improve probably by, let's say, 800, 900 more transplants a year.
And that is a better way to find out what your true potential is.
Yeah, we think so, because we could go beyond, but this is difficult. I mean, what does not arrive to the hospital is very difficult to evaluate. I know, or we know, that many people does not arrive to the hospital, die at home, or is not transferred into these hospitals authorized to deal with organ donation, die in another hospitals. But if we want to cover everything, probably we would be very less effective in covering what we are covering. And then we have some room still for the improvement. So we did not reach the maximum. So
presently, how many people are on the waiting list in Spain this year?
4,000, more than 4,000. 4,000 for kidney, 600 for more or less at the present moment, 600 or 650 for livers, and let's say 100 and something for hearts, and 100 and something for lungs, and maybe 20 for small bowel, maybe 70 or 60 for pancreas. So it could be 5,000 or around 5,000.
Around 5. And what is the population of Spain?
43 million. 43 something million.
And in Canada, we have a very low rate, and I think we have about 275 to 300 people that are passing away every year on the waiting list. Is there any way to indicate a statistic in that same manner?
Deaths.
Of deaths that are...
Yeah, we have, it depends on the organ, but we have around 10% is the overall figure. It is less for liver, it is higher for lungs. It depends on the
so when we say, or when the figure of, I think it's 34.5 per million donors, how can you translate that to how many lives get, sorry?
Organs, 2.54 organs per donor.
Per donor. Okay, so then each year
3,700 or so.
So that's almost 60-70%, so, which is 3 times the amount of most countries. So that, because a lot of people want to see this in so many different ways.
Yeah.
When they say how is a country improving, when we give these statistics of 14.3 opposed to 34, it doesn't translate to them. Well, is that big or is that small?
Yeah.
You know, so.
But you have to put it in the context of the country, and then the waiting list and the facilities to exchange organs, and you cannot compare countries like Canada with countries like Spain. It is very easy to move across to Spain, and it is very difficult to move across Canada or Argentina. You have to imagine that from the south to the north of Argentina is the same distance as from here to Moscow. And you have crossed 20 countries from here to Moscow, and it's 4,000 kilometers, like between the north and the south of Argentina, or the east and the west of Canada, which is 6,000 kilometers. So.
About 7,000.
7,000. So, I mean, this is not comparable. And the rate, I know that the rate of mortality at home in Canada is higher, much higher than here. So people does not arrive to the hospital in many areas. It is quite easy if you live in Toronto area to arrive to the hospital, but it's not so easy if you have to take an helicopter. This happens in Australia, where the people can live in farms in the center of the country and have to take the plane to go to the most closest city, because the most closest city is 1,000 kilometers far from your home, and then this is unbelievable for us. I mean, I cannot imagine
one of the
big
challenges.
distances.
Yeah, geographical.
This is one point. I mean, I do not think that systems of work are exportable like oranges or bananas. You have to put in your way of work in the context of your daily life, your health system, your possibilities, your demography, your geographic situation, and so on and so on. And probably it is not comparable, or the rates are not comparable.
I think the way that we are looking to Spain to be our role models is in your attitude and perception of organ and tissue donations, as well as the attention that you give it. I think that's what's the main difference. Each country is different in its culture, geographic, but if we had given it the same importance and the same attention, and made it a priority, and the perception, the attitude would change, then we could develop the most effective systems. But I think as a student studying Spain now for many years on how the system was so successful, I think it lies mostly in the attitude and perception of organ and tissue donation. And that is what we're trying to transpire over to our country. So looking at all the different ways that you have tackled each challenge and addressed each shortcoming, it's because of the attitude and perception that you had concerning. So if we had that same degree of attitude, we would be able to tackle our own personal challenges in the same, in a different way, but with the same motivation and enthusiasm. So that is why it is so important that we find out how Spain did it, and that we make this as serious as possible to our government. It has been very hard to have the government understand how important this is, and I think part of the reason is that the idea of saving a life was somewhere lost, and the idea of transplantation being almost a cure was not integrated. So we are trying to change that, and so we are doing it by being very provocative as well as inspiring. So with these ingredients, we are hoping that things will change in the next couple of years. We've been at this for quite a while now, and it's probably the same journey that people that I've been talking to in the United States, in England, and Australia. They are having the same difficulties with their present government to make some needed changes and some. So I don't know if there was something to do with being an Anglo country as opposed to a European Latin. I don't know if there was something to do with that as far as the government thinking. It could lie somewhere, because if it does lie somewhere there, then it is good to know that so you can address it more properly. So we're also researching that aspect to see, because why is it that all the Anglo countries are hesitant to, you know, embrace this, and you know, to all your counterparts in Italy, France, Portuguese, they embraced it, you know. So we're
different mentality.
Exactly. So you know, but we're hoping our number one is the public is behind this, and I know because we've traveled through 500 communities in Canada. And our media is behind this as well. They're saying it's only.
Excuse me. What are your plans for right
this
now?
afternoon? I'm just finishing up with you. I'm going to do a photo op with some of the people here, and then I should be finished.
Okay. Because I have to write some reports before going. Do you want to eat something?
Oh, okay.
We are going to eat now.
Okay.
If you want, you can come with us. Okay.
Yes.
And then you can, because
and
I have to write
after
something right now.
Okay.
And I can see you tomorrow, maybe if you come again.
Sure.
Or,
I would like to. Yes.
I will be here because I have all the day. I'm meeting right in the other building, but I will be here in the middle of the day.
Can I leave this here?
Yes. Yeah, of
Okay.
course. Safe and.
Okay.
Between 2 and 3.
Yes.